Good afternoon, everybody. My name is Dr. Geoffrey Grammer. I'm the Chief Medical Officer for Greenbrook TMS. Now, not only do we find ourselves in Mental Health Awareness Month, but also we find ourselves in the middle of a global pandemic. Now, it's more important than ever to maintain your physical and emotional health. Today, I'm going to go over specifically Major Depressive Disorder, some treatment options, and as well as when to know to access treatment. So I first want to start off talking about the signs and symptoms of depression. Depression is a diagnosis that's given when somebody has a constellation of symptoms for 2 weeks or more. Those symptoms can include feelings of sadness more often than not, more days than not, having a decrease in interest in your activities or decreased enjoyment in the activities that you do, feeling badly about yourself, sensations of guilt or worthlessness, a decrease in energy, a poor concentration or difficulty with memory, feeling either slowed down or sped up with sort of an emotional nervous energy, changes in appetite, which can be either a decrease in appetite or an increase in appetite, and sometimes those are severe enough to be associated with a change in weight. Depression can also impact someone's sleep and lead to either an increase in sleep or a decrease in sleep or a fragmentation of sleep where you're waking up or having difficulty falling asleep and the sleep never feels quite restful. And at an extreme, symptoms of depression can include thoughts of suicide or recurring thoughts of death. And when someone has 5 of those symptoms for more than 2 weeks, we call that a major depressive episode. One of the most common causes of depressive episodes is major depressive disorder. Now, there's a couple of things to think about here. One is depression is a medical illness, and it is important that people recognize it as such. The brain is an organ, and that organ controls our thoughts and emotions. So when it's not working correctly, it leads to alterations in those things. And for major depressive disorder, that can lead to a persistently depressed mood that seems independent of your environment. If there's any takeaway from this presentation, it is that I hope everyone understands that depression is a medical illness and it requires medical treatment. I want to show a scan as an example of this. So this is a PET scan right here, and here is a patient with depression, and this is a patient without depression. This is a measure of metabolic activity. So the depressed brain has a decrease in metabolic activity in certain areas, and that keeps it from functioning correctly, and we want to restore it to this. So the reason I bring this up is because I want people to understand that depression requires a medical intervention to fix areas of the brain that aren't functioning correctly. To crystallize this a bit, I want to go over an anecdote. So for those that read my bio, I was in the Army for 25 years. I did 2 tours in Iraq and 1 tour in Afghanistan. During one of my combat tours, I had a patient present with severe depressive symptoms. And that person had been struggling with this for quite some time. When I asked why she hadn't presented sooner, she had told me that she had notified her supervisor, who was actually trying to work with her on lifestyle modifications to fix the depression. So he would spend time talking to her, trying to help her, even took her for ice cream, but her depression kept getting worse and worse until it reached a critical stage. So once she presented from care, we were able to institute treatment and help her feel better. But the point was, sometimes depression, often depression, is not resolved by simple lifestyle modification. And I don't want people at home suffering, feeling that somehow they feel responsible for the burden of their symptoms. We really need to think of it like a medical illness. Now, when should we be concerned about depression? When is it so bad that we need to access care urgently? Well, there are a couple of big red flags or warning signs. One of those is an inability to carry on sort of day-to-day activities. If you can't get out of bed, if you're finding that you're not able to eat and maintain adequate nutrition, if you're not showering, and basically can't move, those are all big warning signs. If you develop thoughts of self-harm, that is a big warning sign that says that you should access care relatively urgently. Or if you're engaging in high-risk behaviors, speeding, picking fights with people, high use of alcohol or illicit substance use, all those things that can put you in harm's way, that would be another indication of urgent access to care. Now, accessing care right now is more important than ever. Our physical health is determined in part by our mental health. Those two things are connected. So when we're feeling mentally unwell, that results in a cascade of neuroendocrine consequences that then lowers our immune system and places us at risk for other illnesses. To even emphasize this point, patients with depression can have a decreased life expectancy compared to those who don't, even by more than a decade. So depression is not an inconvenience. It's not some burden that you have to just bear and get through life. It's a medical disease with true medical consequences. Fortunately, there are choices. There are options for treatment. So for a lot of people, they will start off seeing a provider and either initiating medication management or talk therapy. So let's talk first about medication management. The most commonly prescribed medication for depression is the SSRI class. And the way this works is it inhibits this body from recycling serotonin, so it has more time outside the nerve to have its activity. All right. And these are medications like Prozac or fluoxetine, Zoloft or sertraline, Paxil or paroxetine, Lexapro or escitalopram, for the generic or trade names. Now, a lot of primary care will prescribe those, and some behavioral health providers will prescribe those. Now, when those don't work, people will often move to another antidepressant, often in a different class. So usually the next most commonly used medication is the SNRIs, or serotonin norepinephrine reuptake inhibitors. So not only do those then impact serotonin and help increase its activity, but it can also increase the activity of norepinephrine. When that doesn't work, they'll often move on to sort of the atypical antidepressants that have novel mechanisms of action. So some predominantly will impact norepinephrine and dopamine. Others will have kind of unique mechanisms to increase norepinephrine and serotonin, and some of them have very specific interactions on the receiving neurons for signaling, what we call postsynaptic receptors. When that doesn't work, we will lean upon augmentation strategies, and there's a variety of agents that can be effective when added to an antidepressant. Now, unfortunately, about a third of patients treated with multiple medication trials will still not achieve adequate relief of their symptoms. And the likelihood of responding after that, after about 4 med trials, goes down substantially. In addition, a lot of people on medications, while it may help their symptoms, can have intolerable side effects because that medication does have to flow through your bloodstream, get metabolized by the liver or kidneys before it reaches the brain and has its final effect. There's also psychotherapy. The two kinds of psychotherapy that have been shown to be most effective for depression are cognitive behavioral therapy and interpersonal therapy. Cognitive behavioral therapy is a process where you sit down with a therapist and they review the way that you think about things around you. And you actually often will develop charts and you write down these things in columns of what the thought is. We label some of those thoughts with specific names like catastrophic thinking and what have you. And then we try to find a more correct thought, and then we kind of identify how that makes us feel. And the concept behind this is how we think about things can impact our emotions. And that's actually been shown to be about as effective as medications, particularly for mild to moderate depression. Another kind of therapy is interpersonal therapy, which is working on your sense of identity, how you portray yourself to others, and how you see them interacting with you. So both of those can be effective. But unfortunately, the availability of that is not as widespread as would be ideal. And sometimes that's also either not financially possible, or it's just not geographically available. The good news is, after medications and therapy, there is another option, and that option is transcranial magnetic stimulation therapy. So this is an FDA-cleared, non-systemic, non-invasive procedure where we take a magnetic coil and we place it on the scalp and pulse down a magnetic field onto the brain to fix those areas that aren't functioning correctly. So I have another chart to help illustrate that point right here. And so the good news is when we stimulate here, okay, it will have projections down to other areas of the brain, including areas like the anterior cingulate. Sorry, I'm trying to do this backwards on the camera here. As well as other areas that help control mood and emotion. All right, so by stimulating one area, we can actually have a wide impact on other areas of the brain that are implicated in regulating that mood and emotion. There are different devices out there. One example is the NeuroStar TMS therapy device, which has been around the longest and it's been FDA cleared since 2008. So patients often get treated in a very convenient fashion. You'll go into a center that offers TMS therapy, and you can get that treatment usually somewhere between 20 to 37 and a half minutes. You can do it on your lunch break. You're awake during the entire procedure, and when you're done, you can get up and go about your daily activities, whether it's school or childcare or work or what have you. Okay. Now, how does TMS work? When we pulse down a magnetic field onto a substance that conducts electricity, that creates a current. And your nerves are essentially like biologic wires. So when we pulse the magnetic field down, it makes those nerves activate. It's called an action potential. And by changing the frequency of the device, we can either make areas of the brain work better or work more or less, excuse me. Now, what we do essentially with that then is exercise the areas of the brain that aren't working correctly and restore their function to normal balance. Now, when it does work, what happens? Well, the good news is when people get better with TMS therapy, the majority of people will stay better for up to a year. When the symptoms do return for some people and they get treated again with TMS therapy, the vast majority will respond like they did the first time. So often what we'll do as sort of a primary management with TMS therapy is play whack-a-mole with their depression. When the depression tries to return, we retreat them and we knock it out and we keep them well. The longer someone stays outside of a depressive episode, the more likely they are to remain outside of a depressive episode because we're reinforcing those neural pathways associated with wellness. Now, what about accessing TMS therapy during the COVID-19 pandemic? The company that I work for, which is Greenbrook TMS NeuroHealth, has 124 centers around the country, and all of those are fully operational. All right. As I mentioned before, the CDC has recommended that patients continue in care or access mental health care because of the importance on your overall wellness and staying healthy during this time frame. So TMS is not an elective procedure. TMS is an essential part of some people's treatment plan for treating their depression. The way that we can provide care in this environment in a safe fashion is to utilize rigorous hygiene. So in our clinics, all our staff wear masks. We wipe down all the equipment as well as all surfaces after every single patient. All the patient rooms are private rooms. The waiting room is kept empty, and if there is anyone that uses it, we wipe it down afterwards. We exercise vigorous hand hygiene, either with a hand disinfectant gel or hand washing stations before and after every single patient contact. We even go so far as to wipe down clipboards and pens and anything else that patients can come in contact with. And with those mitigating strategies, it's my opinion that receiving TMS therapy is actually safer than many of the other things that people are doing, including going to the grocery store or the hardware store or what have you. All right. So you shouldn't have to sacrifice your safety for your care, and that includes with TMS therapy. Now, what if you're depressed? Who do you reach out to? Well, if you have a behavioral health provider, let them know that you're not feeling well, and they may make recommendations to try to help you recover. If you don't have a provider, a good place to start is with your primary care. They can usually institute sort of frontline therapies, and if those are ineffective or depending on your severity, they can make referrals as needed and help you get plugged in with more comprehensive care if needed. Now, if you're interested in TMS therapy, you can go to neurostar.com, and in the upper right-hand corner is a physician finder, and you type in your zip code, and it'll show you providers in your area that are offering TMS therapy. So I do want to make sure that I have time to answer a couple of questions. Okay, and let's see here. I have a question from Colleen. What does TMS treatment feel like? Does it hurt? So for NeuroStar TMS therapy, what you'll do is you'll come in, sit in a chair. It will recline about 60 degrees. We'll put a paper strap over the forehead. It's got a small adhesive right in the front to keep it in place. And it's got a little bit of an arrow on there so we can do our setup on the device, which is essentially keeping the head secure in a very comfortable cradle, a padded, essentially, cup. It sits on the back of your head. And we place the coil onto the scalp, and we pulse down that magnetic field. Now, when that magnetic field pulses down, it will activate not only your brain, but nerves and muscles within the scalp. And so point site discomfort where we're actually doing the stimulation can be an issue for some patients. Now, the good news is the vast majority of patients tolerate TMS just fine, but it can feel a little bit uncomfortable right underneath the coil onto the scalp. Sometimes that discomfort can radiate behind the eye, to the tip of the nose, or in the teeth, so it can feel like it's migrating, but that's just the nerves kind of carrying on the signals. There are some things that we can do with the device to actually make it more comfortable. Some people can be left with a headache. Usually that goes away really, really quickly after the treatment, within a few minutes. Some people can experience some eye twitching during the procedure, but again, that's also very, very transient. Bottom line is the vast majority of people tolerate TMS very, very well and are able to return to activities immediately afterwards with no residual effects. It's important that you talk with your TMS provider about your unique circumstances in your case on what side effects you may experience and how best to handle those should they arise. Now, I got one more question. Let's see. This is from Randy. Do I have to stop taking antidepressants to try NeuroStar TMS? So no, is the short answer. You know, for some people, medications actually are working. They're just not working well enough. You know, the goal here is to achieve a full resolution of the depressive symptoms. It's not necessarily to feel just better, but it's to feel well. So if medications got you part of the way there, TMS therapy might be what you need to kind of get you over to the finish line of feeling completely recovered. Now, for other people, medications are ineffective or they are causing intolerable side effects. And in those circumstances, you may want to come off of those medications and use TMS therapy alone instead. Because each case is unique, you definitely want to talk with your providers, both your TMS provider and, if it's different, your prescribing provider, on the best timing for tapering off of medications. I would ask, though, if you're interested in stopping your medications, do not do that alone. Make sure you're doing that in consultation with one of your providers, because some of those require specific tapering schedules, and there may be other clinical concerns that your provider wants you to factor in as you make an informed choice on how best to proceed with your treatment plan. So we are out of time. I want to thank everyone for joining us here today. If we didn't get to your question, I would ask that you send a message to NeuroStar, and we will do our best to answer those for you. I hope that everyone stays healthy and safe during this period. And please, 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 if you think you may need help with treatment of your depression, reach out to a behavioral health provider. And if you're finding that medications and therapy are not enough, consider TMS therapy, and you can find a provider to offer that to you by going to neurostar.com. So this is Dr. Grammer. Thank you very much, and I'm going to log off. Everyone take care.